Hello everyone. My name is T, and my channel is Define Makeup by T. And today I have decided to share my story with rheumatoid arthritis. I have basically been living with rheumatoid arthritis probably for about the past, I don't know, 7 years. And it's not really it's not an easy life to live. Um, I go through my ups and downs, and I've been struggling back and forth. Well, actually, I could say I've been back and forth with um, whether or not I was going to share my story or if I was going to um, just keep it to myself. Today, I'm stuck in the bed. It's a really hard day for me today. I like I said, I have my ups and downs, and I really wish that things would be a lot different in my life, but I cannot change the fact that I have rheumatoid arthritis. So I would like for you guys, whomever is watching, if you are already a subscriber to my YouTube channel, Define Makeup by T, thank you for tuning in, and thanks for watching. Please ask as many questions as you can, or as you would like, I should say. I am going to answer every question to the best of my ability. Remember, I am not a doctor. This is just my story and how I live my life with rheumatoid arthritis. If you follow me on Snapchat, you know that I've been announcing that I'm going to publicize my life with rheumatoid arthritis, or RA as I call it. So if I happen to say RA during this live video, just know that I'm still referring to rheumatoid arthritis. So without further ado, I guess we can get started. This is my first time live streaming with YouTube and Google Plus, so please kind of bear with me, as I kind of figure things out. I just got this pop-up. I'm sorry, you guys. I have no idea how to get rid of this. Okay, there we go. So today it's like a really bad day for me. I woke up this morning and I was feeling really, really crappy. My joints is typically stiff when I first get up in the morning. I really have no control over that. I take a bunch of different medications. I take methotrexate. Come on. I take methotrexate, and I take another new medicine that they just start giving me. My system is so crazy because I'm allergic to a lot of different things. So it's kind of hard for me to take medicines. But I'm going to show you guys like the many medicines that I take. I tried an injection, Humira, and the effects that Humira had on me was unbearable. But what I actually want to do is to go into details and explain to you guys before I go all off into that, exactly what rheumatoid arthritis is and how it affects your body and stuff like that. And I could actually do that if my son would bring me my phone. Yes, my cell phone with him. So I can't really, let me open my screen up. See if I can get it wider. Okay, there we go. So I am not using any lighting because I am stuck in this bed and the lighting hurts. So I'm just kind of waiting for the rest of everyone to join in. I have my phone now. So I'm going to give you guys a little bit of my background of what rheumatoid arthritis is and how it basically affects your body. So rheumatoid arthritis is an autoimmune disease, and it affects your joints in your body. It actually affects your whole immune system. That's why it's called an autoimmune disease. It affects your lungs. It affects it can affect your liver. It can affect your eyes, like a bunch of different things that happens. But I'm gonna start off from the beginning and just tell you like what rheumatoid arthritis is and the symptoms and things like that to look for. So rheumatoid arthritis, like I said, is an autoimmune disease, and what it does is it attacks the immune system, the healthy tissues in your joints, which makes your joints swollen and stiff. So if you recall, when I first started, I said, you know, when I get up in the morning, I'm like really, really stiff and just unable to move, and it takes me a while to get going. Sometimes I'm like that all day long. Sometimes it's about 45 minutes long. But here recently, I've been like in that situation for pretty much all day. Today, I am pretty much stuck in the bed. I can get up and move around, but I'm just in so much pain that I'd rather not even be up and about. It just is what it is. Also with the stiffness comes pain, which I just said I'm in so much pain. And so it just makes life really, really unbearable. And if you don't have rheumatoid arthritis, it's really hard to explain to somebody like what you go through on a day-to-day basis. Like, for example, I can get up today and try and open up a simple jar of peanut butter, or maybe I'm trying to get the lid off of the coffee to make my instant coffee, and I'm unable to do that. It's just really bad when you're in a situation like that, and you know you can't just do simple things like opening my bedroom door. Every night I close my bedroom door, and sometimes when I get up, it's hard for me to, you know, turn that handle. But that's just some of the things that I deal with. Over time, rheumatoid arthritis destroys your joint tissues and make it hard for you to walk around and utilize your hands. When I first, 7 years ago, I woke up and was unable to walk. My husband had to literally carry me to the bathroom. That's how bad it was. I was crying. I couldn't move. I didn't know what was going on. I could not use my feet. It took me a few days to get into the to my regular primary care doctor. And then I found out she was on vacation, so I had to see another doctor. Immediately upon explaining my situation to her, she said to me, "Oh, I know exactly what it is. You have rheumatoid arthritis." At the time, I had no idea of what rheumatoid arthritis was and how it would drastically change my life. But I am still here today to tell my story. So I guess I am truly blessed that I'm still here and alive. Although my life this year has changed dramatically, which I will again go into a little bit later, but I want to continue to explain the disease so that when you guys start to ask questions, you know, I can pretty much answer them. Give me a second, I'm gonna read what's on my phone. So I take a bunch of different medicines and stuff like that, like I was saying, and I'm gonna show you guys like what medicines I take, but there is no cure for rheumatoid arthritis. The medicine that they give you slows the disease down. Eventually, you will become crippled or, you know, unable to walk and move around to the point where your joints is like stuck like this. I don't know if you guys have seen older people, maybe like in a nursing home or a hospital or just out and about. And some of you who watched the Sanford and Son remember Fred Sanford saying that his fingers were stuck like this. He couldn't do anything. That's a form of rheumatoid arthritis. Or maybe you've seen somebody's feet turned in like this, or they were in a fetal position, cradle, where they couldn't open their legs. That's a form of rheumatoid arthritis. And there is no cure as of right now today for it. So nobody knows what causes rheumatoid arthritis. Some people say it's in the genes, and I know for a fact it runs deep in my family. I can testify that I have cousins, my mom has it, I have uncles and aunties that have it. So I guess I'm just one of the family members that got it. So yeah, genes play a role in it, but they don't really know for sure. So in regards to genes, one or more of your genes may make it more likely that the body's immune system will attack the tissues in your joints. So that's what doctors say. This immune response may also be a trigger by bacteria. Okay, so initially I started off with a sinus infection, which is basically a bacteria infection. It got worse, it got worse, it got worse. They could not clear it up. Rheumatoid arthritis has affected my sinuses to the point where I had to have surgery. They removed something, I can't tell you what it was they removed, and now it affects my ear every once in a while. It can come in a form as a virus. I went into the hospital before for respiratory infection, and was like hospitalized for days. So it definitely affects your lungs. It's just a really hard thing to deal with. So I want to tell you like the signs of rheumatoid arthritis. Like I said, I woke up one morning and was unable to walk. So one of the signs is joint pain. And joint pain can be an early sign that you have rheumatoid arthritis. It can happen suddenly like mine, or kind of slowly as it, you know, progresses. Fatigue, I am always tired. Like I said, the stiffness. And it may not be that you have rheumatoid arthritis. It may be like another form of arthritis that you have. So, you know, you might want to check with your doctor. My symptoms, my situation could be totally different from yours. So this is just my way of letting you know, like, what I'm going through and what I dealt with. Some people deal with weight loss, or some people have a fever. But a true all-tell sign is that you have painful, swollen, tender, stiff joints. And typically they say that the joints are it's in both joints, whether it's your fingers, it's both hands, or both ankles, or both your knees, or your shoulders, or your elbows. Like it affects every part of your body. Your hips, typically doctors say that it's both joints, but in my case, it's not always been both joints. Sometimes it was like just my right foot, or my left hand or my right hand. Sometimes it's just my left shoulder. It just all depends on that the person. But they say that it's supposed to be systematic, but I don't find that to be true. Again, I am not a doctor. This is just my system and my belief in what I've went through for the past 7 years. It affects your wrists, your elbows, your feet, your ankles, and your knees, of course, your neck. Like I said before, you have morning stiffness. Joint stiffness develops after a long period of sleeping or sitting. So if you sleep for a long time or if you sit for a long time, you'll get that stiffness. Lasts at least 60 minutes and often several hours. Sometimes that's not true. Sometimes mine lasts all day long. So it just depends. I have developed these bumps on my legs. That's called nodules or rheumatoid nodules. And they range in size. Sometimes they're really small, like mine is like a pea size. Some can be as big as a mothball. It just all depends. From what I'm reading here, 1/3 of the people have those nodules. And it's normally over pressure points. Like mine is down, by the lower skinny portion of my leg. So the nodules will happen in your elbows, knuckles, spine, and lower leg bone. So mine is in the lower part of my leg. So rheumatoid arthritis affects, like I said, pretty much your system. You can be fatigued or really tired, have a loss of weight, weight gain, loss of appetite, maybe a fever. In my case, it's affecting my eyes. I have dry eyes. It affects my eyesight sometimes. It's affecting my lungs, where I now have to use a machine to sleep with and a machine to keep my breathing, like an aerosol machine for asthma, stuff like that. I got a gang of medicine that I'm going to show you guys. And I'm streaming live, so I kind of don't have my notes in front of me. So I was explaining prior that the rheumatoid arthritis, or I call it RA. If you follow me and you're familiar, I've been snapping it out and chatting out that, hey Raquel, that I was going to go ahead and do a live feed because I'm kind of tired of people asking me what's wrong and why I have this boot on and why I have to wear this and what's going on in my life. So this is my way of letting everybody know my situation and how I'm dealing with it. And I'm tired of letting rheumatoid arthritis control me. I'm going to learn to control it. So that's why I'm doing a live video. So I'm live on Facebook, I'm live on Google, and I'm live on YouTube. So if I'm veering off and answering, I'm just trying to get everybody questions. So just ask questions. Don't be afraid. I ain't shy. I don't get mad anymore. Notice I said anymore, because it used to make me real mad. People ask me, well, what's wrong with you? But I've learned to accept it, and I'm going to move on. So I'm stuck in the bed, which is why I'm filming from my bed. Because when I woke up this morning, I could not get out the bed to even go to the bathroom. I was literally crawling, and I got to the point where I won't even wake my husband Michael up now. I just deal with it on my own, and I get there how I get there. So this morning I was pretty much crawling to the bathroom, and I just knew that it wasn't a day that I was going to be going to work. My job is pretty understanding, so I'm kind of glad that I had a company that knows my situation and understands. So I'm kind of going to backtrack, since I got some new people joined in, and just kind of go over what rheumatoid arthritis is. So if you're in the medical field, then you probably already know. Rheumatoid arthritis is an autoimmune disease. It pretty much affects your entire body. Sometimes it could come in and it I don't even know how to say it. It imitates other diseases. Like you might be diagnosed diagnosed with lupus when it's actually rheumatoid arthritis, or you could be diagnosed with rheumatoid arthritis when it's actually lupus. So it imitates a lot of diseases, but it affects your entire body. In my case, it has affected my eyes. It has affected my lungs, especially my joints. It's definitely affecting my joints. I deal with a lot of stiffness, a lot of pain. I spend many nights up crying with my husband holding me, going, it's gonna be all right. But in my mind, it's not gonna be all right. And so I just recently went through this year where I was back to like square one. When I first was diagnosed with the disease 7 years ago, I was told, I know I said it, I'm just repeating for everybody else. I was told that immediately I had rheumatoid arthritis, and I just literally woke up one day and couldn't walk. Literally hit the floor. I stood up, hit the floor, couldn't walk. And I was just kind of like, damn, what's going on? So I was crying and telling my husband, like, they thought I was playing, like I really couldn't walk. So it took like my husband to literally pick me up, carry me to the bathroom, just so that I could use the bathroom. And I tried to get in with my doctor, but my doctor was on vacation. You know how that go. So I had to wait to see another doctor. So I was just to the point where, like, after 24 hours, it was worse. So I decided to go to the ER. The ER passed it off that I kind of sprained something. But the next day when I seen this new doctor, she immediately said, oh, I know what's wrong with you. You have rheumatoid arthritis. And at the time, I had no idea what rheumatoid arthritis was or how it would drastically affect my life. So today I am a witness that rheumatoid arthritis is no joke and nothing to play with. I kind of took it lightly. They gave me a steroid called prednisone. So after like a week, I was cool. Finally got in to see my normal doctor. And she basically said, well, you know, you have to take this blood test, blase. If it shows up in your blood, then we know you have it. What I didn't know then that I do know now is 90% of the people that's diagnosed with rheumatoid arthritis, it never shows up in your blood. So because it doesn't show up in your blood, they think, oh, you don't have it. It's a misdiagnosis. And she kept saying to me, it's a misdiagnosis. It's a misdiagnosis. But I was experiencing these stiff joints. I couldn't walk. I couldn't get out of the bed. I couldn't open cans or jars. I couldn't even turn the damn doorknob to get out of the door. Like, it was just getting worse and worse and worse. So finally, my mother got pissed off and took control and had that doctor to send me to a rheumatologist. The first doctor I seen was Dr. Chung, and I wish like hell he was still here, because he was the one doctor that broke everything down and explained everything to me. Thanks for joining. He pretty much broke everything down to me and told me what rheumatoid arthritis was. And then that's when I started taking methotrexate. I initially started off with like 2 pills once a week. But as time progressed, I ended up taking more pills and more pills and more pills and more pills, to the point where now the medicine is not even helping me. I'm up to 6 pills with methotrexate, which is a medicine that prevents the disease from turning your joints, or it's supposed to. But in my case, it's not even working because my feet is starting to turn in now, which is why I have to wear the brace. I'm going to explain that in a minute. But yeah, I have to wear the brace on my foot because my joints are starting to turn. So with that being said, they tried me after 7 years of taking methotrexate and me saying that it's not working. I'm taking prednisone, and then the prednisone started giving me thrusts in my mouth like I was a little damn kid, sucking on ceilings and pieces of wood and eat shit off the ground. I would get thrust in my mouth. And so this year I refuse to take prednisone or any type of steroid. It's blowing me up. It's affecting my body. It's making me bloated. It's doing all kind of shit to me. So I'm refusing to take that. I'm serious, Raquel. So I'm refusing to take that. So they tried me with Humira. Everybody's seen the miracle drug for Humira. It helps you do this. It helps you do that. It's supposed to be the miracle drug if you got bowel syndrome, if you have rheumatoid arthritis. Well, I am here to testify that Humira messed me up. I had 2 doses of the injection. One in my rheumatologist's office and one that I did at home myself with some nurse that came to my house that really aggravated the crap out of me. But anyway, the Humira, I started having like seizures. Initially, it started off where I would just get stuck, or I was having like memory loss. I would be driving and forget where the hell I was going. Then I would have to call Michael and go, Michael, where was I going? I'm lost. I don't know where I'm at. I was on my way to work. I worked out in Westlake and ended up on the damn turnpike. That's how bad it was. So I said, well, I started thinking like, well, you know, what the hell is going on? Why is this happening to me? So I started researching Humira, which I should have done prior to taking the medicine. I knew about the warning signs on the commercial, but what they don't tell you is the fact that you can have seizures behind the Humira. You can have memory loss. My seizures had gotten so bad where I wasn't convulsing, but I would just get stuck. Kind of like that. Just stuck, and people talking to me, and I'm just sitting there, I'm just looking. And then it got to the point where my body would just start shaking. So I stopped taking the Humira. So now they tried me with another new drug. Can't even tell you the name of it. I took it probably for all of a week. It started making me sick where every time I took it, I just threw up. So I'm going to show you guys the rest of my medicine in a minute as to what I take on a day-to-day basis. But definitely ask questions. That's why I'm doing this. And I'm probably going to add it to my YouTube station. So if you guys are not joining me from my YouTube is Define Makeup, where I do all my makeup at. It's Define Makeup by T on YouTube, or Define Makeup 73 that I do my makeup on. And I'm just going to add this to probably like my channel maybe once a week or twice a week. We can go over and sit down and talk about rheumatoid arthritis. So if you think you have it, these are the symptoms. And don't go back and say Teresa Diamond told me shit. I ain't no doctor. I'm going to tell y'all now. I'm just going to tell you what I've been through and what I'm experiencing. So stiffness. Stiffness can come from any form of arthritis, but the stiffness that you will have will be so unbearable. I love you too, Raquel. Thank you. Stiffness will be so unbearable that you cannot even move. Hi, Cara. Thanks for joining. It will be so unbearable that you cannot move. The stiffness that you feel will be like no other stiffness that you will ever deal with. It's not like a muscle stiffness where you done did too much for the day. You done been out in the mall, you done kicked it, you done went to the club, you danced too hard, you're stiff because you're a little too old for that shit. No, it's past that level. This is the level you're on. So say example, you went to the gym, you worked out, you overworked your muscles. That tight stiffness that you get and your muscles is hurting you so bad because you done did too many push-ups or too many sit-ups, or you done rode that bike or got on that treadmill for too long and you can't move. That's the stiffness. No, all over. This is all over your body. You'll feel that stiffness. Mostly your hands and your ankles, Raquel, is where you'll feel the stiffness at. In my case, I feel it all over. I have it in my knees, I have it in my ankles, I have it in my wrists, my shoulders, my neck, my hands. Oh my God, you could just hang it up. Like today, I woke up, I knew it wasn't happening. So you'll have that stiffness. Follow up with the stiffness, it'll be a pain like no other pain. Just look at it like this. If somebody took a hammer and smash that hammer down, you know, if you put a nail in the wall and you accidentally hit your finger with that hammer, that's the pain you're going to feel with rheumatoid arthritis. It's an undescribable pain, but you'll know when that pain hits you that I gotta sit down. It's not gonna happen today. So that's the pain that you will feel. You'll have constant dry eyes. You'll want to cry. Like right now, like in the beginning when I started, I wanted to cry, but I couldn't cry because I can't form a tear. I got to put a drop in my eye to form a tear. So my kids laugh at me now because when I cry, they say I go, a tea, a tea, a tea, because I can't form tears. I can yarn like crazy and I get a tear, but if I'm trying to cry, it ain't gonna happen. So it affects my eyes. I don't know. What other questions do you guys got for me? Because I could talk about this like all day long, and just give you like a basic on what's going on in my life. Oh, I said before I start asking and answering questions, I told you guys I was going to talk about why initially I was in that boot, because they thought it was tendonitis. So I was in the boot for like 3 months, and I kept saying to them, like, it got to be something different. I knew that it was different. I got to have humor, because if I don't, like, I'll fall apart. But I knew it was a different feeling than what my normal rheumatoid arthritis was. And I kept saying to the doctor, this is different. It cannot be rheumatoid arthritis. This is different. So initially they did x-rays and stuff and thought that it was tendonitis. I wore this damn boot for 3 months, y'all. I hated that boot. It got on my nerves. I was so glad that when it started getting hot that I didn't have to wear that damn boot no more. But initially they did x-rays and said, yeah, you got tendonitis. The swelling from your rheumatoid arthritis affected your tendons and your tendons collapsed. So this boot is supposed to be the all cure for the tendonitis. Well, it wasn't the all cure. I kept saying to the doctor, it hurt. I'm still in a lot of pain. I asked for pain medicine. They didn't want to give me the pain medicine that I needed. They wanted to give me some crap. So finally the doctor that I was seeing, the foot doctor that I was seeing, said, well, we're going to send you to get an MRI because it's not normal. It should have healed by now, especially since I wasn't working. I kept my leg propped up. I was really, really doing everything that I was supposed to do. And so I did the MRI, and the MRI showed that my bones and my joints was literally curving in. They did an impression of my left foot and my right foot. So my right foot is kind of turning in like this. So if I was to show you guys how I'm sitting straight in the bed, and right now my right foot is turned in like this. Well, not all the way, probably like a third of the way. So that's why I have to wear that stupid brace on my foot. And I hate that damn brace too, because it's really too hot for that. That brace is putting a bruise on my leg. So we're gonna have to do something about that brace too. But what it has done is it eased up a lot of the pain. If I'm on my foot for too long, I can tell because my foot will start hurting. But it's supposed to prevent the turning. Now, if you go back to what I said with rheumatoid arthritis, there is no cure for rheumatoid arthritis. The medicine only helps to prevent your joints from curving in or your bones from breaking and stuff like that. With that being said, I have had rheumatoid arthritis for 7 years. I have been on every medicine out there. I'm pretty sure I've taken, if not a third of it, if not half of it, a third of it. So I know for a fact that they're saying it's a preventive. It might slow the process down, but I don't think it prevents it. And that's just my opinion. Again, I'm not no doctor, so don't be going and telling nobody I said whatever. My opinion, it only slows it down. It does not prevent it. So if they tell you that this is the miracle drug, like they told me, and that it's going to prevent you from having any effects whatsoever, no. You'll always have a flare-up. You'll always end up in a place where you don't want to be. When I got pregnant with my youngest son, Michael, I went in what we call a remission. And I thought, damn, I'm cured. If I had known years ago all I needed to do was have a baby, then I would have had a baby a long time ago. After I had during my pregnancy, I had no symptoms of rheumatoid arthritis. I was good. After I had him, I went 3 years with no symptoms. After that third year, my RA hit me so hard that I was literally on my knees in so much pain. I said, what the hell? I went to the doctor. I said, I thought I was good. Like I had the baby. What happens is your baby produces hormones that a person with rheumatoid arthritis loses. Those hormones, I don't have my notes. I can't get in my phone, but those hormones, um, how can I explain it? Those hormones kind of protects the body is what it does. It protects the body from any antibodies or any bacteria that's going to affect and cause swelling. So during my pregnancy, my son had produced so many hormones in my body that it didn't affect me for like 4 years. After having him, my hormone levels started to go back to normal. And then that's when the effects of the arthritis hit me. But it hit me worse than it had ever hit me. Why? They say, because you stopped taking your medicine. No, it's because my body literally went into recession. If you look it up, read up on it, it'll tell you rheumatoid arthritis your body can go in recession. Now, with women, and it affects women more so than it affects men. But in women, when you start going into menopause, your rheumatoid arthritis will go cray now, which is what's happening to me. I'm not in menopause, but I had a hysterectomy this year. So now it's really acting stupid. And so I'm at a point now where I'm just like, whatever. I'm just not about to let it control me no more, because it's controlled me for like 7 years. And I'm just going to basically do me. And so today was like my final day. I woke up today and I was like, fuck that. Like, look, something got to give. Like, somebody got to do something, or this shit got to stop. And excuse me, but that's exactly how I was today. And so I said I had been Snapchatting out that I was going to do a review and talk about my life with rheumatoid arthritis. But it's so personal and so private that it's kind of really hard to get into and like really explain to a person like on your day-to-day daily duties of what you go through. And it's not just the fact that it affects your immune system or it affects your joints. It's sometimes it's hard for me to even focus. Like, this lady was talking to me and she was getting on she was just talking. She went from one subject to the next. And I was thinking, like, damn, will you shut the hell up, lady? You doing too much right now. Like, I really wasn't feeling it. I was in the doctor's office to begin with. So if I'm in the doctor's office, why are you chopping it up with me like this? Like, I'm not feeling you. I kind of wanted to tell her to shut up, but I was being nice. And it got to the point where I couldn't even focus on what the hell she was saying. So it messes with your ability to focus. It messes with your ability to concentrate. I have migraines out of this world, and at first I didn't realize that the migraines was coming from the rheumatoid arthritis. But upon a little further investigation, I found out that the rheumatoid arthritis was affecting a part of my brain that gives, I guess, a pain center or whatever the hell it's called. But it gets so bad that I'll have a migraine, which is probably why I'm sitting in the dark right now, because I can't even think about a migraine right now. 1 second, y'all. I seen a, oh wait, I forgot I gotta type it in. I seen a rheumatologist. The question was, what type of doctor that do I see? And it's a rheumatologist. I switched from university. I spelled that wrong, but you know what I mean. I switched from university to Cleveland Clinic because university was just playing too many games with me. And I think if I had switched sooner, I probably might not be in a predicament that I'm in now. But it is what it is. So it affects my back. Yes. Affects. It feels like oh, my back. I'm sorry. Okay, so when it affects my back, it's to the point where, say for example, if you pull the muscle in your back and you want to bend over, well, a normal person bends from the waist or tries to bend from the waist. I can't bend from the waist because if I bend from the waist, I end up on the floor. So I just don't even fucking bend, period. To tell you the truth. If I drop something, it's on the floor until somebody else. If I drop something, it's on the floor until somebody else can come get it. Cause I just can't even deal. I can't even think about trying to pick something up, especially on a day like today. So yeah, it affects my back. It's a joint. Your back is a joint, so it affects your back. So the parts of my body that it affects, again, it affects my neck, the back of my neck. Sometimes I get to the point where my doctor had to tell me, I had to do, well, my physical therapist told me that I was so used to looking down like this, holding my phone on Facebook or whatever it is I'm doing, that he had to tell me that I had to hold it up like this. So I still haven't got used to that. So my neck will get stuck in a position where I can't turn it left or right. So I had these neck exercises that I have to do. The rheumatoid arthritis affects my shoulder blade. Not to the point where I can't move it, but I feel a pop or so, and it gets really painful. I don't know if y'all can see it. I'm gonna switch hands right quick. So this band that I'm wearing right now is to help me not to move the bending part of my arm. Because if I move it, it'll just be real painful. At first they told me, oh, you got tennis elbow. Not. It's because of rheumatoid arthritis. I thought I had carpal tunnel. I have these braces that I put on my hand that I'm supposed to wear while I'm typing, but if you guys can see, I'm not about to, I can't. It gets on my nerves. If I'm hurting really bad, I'll wear it. But if I'm trying to type something like today, I'm not about to put that thing on. But it's kind of like the braces that you'll wear for carpal tunnel. And then now I got the brace for my foot. So yeah, it affects my joints in my toes, my fingers, my wrists, my ankles, my knees, my hips, my shoulders, my neck, my elbows, the bending of my arms, my back. I think I got everything. Hi Renata, thanks for joining. I'm just kind of going over like my life with rheumatoid arthritis. So if you have any questions, just ask. I have no problems with answering them. I kind of, if you want to get caught up, I've been talking about a lot right now. So if you kind of want to get caught up, Renata, you can like tune in. It'll be saved to my YouTube. It's Define Makeup. I'll post it. And on Google Plus if you're on Google Plus. But I'm gonna show y'all like all this medicine that I have to take. I hope y'all can still see me. I'm trying to, cause I'm on Facebook today live. I'm on YouTube live right now and Google Plus. So the methotrexate I take 6 pills once a week. So I try to do it every Monday. This medicine is hydrochloric hydrochloroquine. And I say it wrong. I tear it up every time I go get it. But this is another medicine I take. It's supposed to assist with the rheumatoid arthritis. I take it once a day, but they finna increase that to twice a day because the other medicine that I was on, it made me throw up. I couldn't take. So I have to take vitamins and folic acid and all this. So I take, and potassium pills. But because my potassium level and my vitamin D levels are super, super low, so this is the vitamin D that I take, and I take that 5,000 BTUs. I take folic acid. Hey, Teresa. Hey, little mama. Hey, Angel. Thanks for joining. I'm just pretty much talking about my RA and what I deal with. I'm just going over, like, my medicine and stuff. So if y'all have any questions, don't hesitate to ask. I don't mind answering. But I take folic acid because it affected my system so bad that I have to take the medicine to produce folic acid in my body. And my potassium is so low that I have to take like potassium pills now. So that's another medicine. I think I take like 10 different medicines. I could be over exaggerating, but yeah. What is this? Oh, I call this, y'all about to laugh though, but I call this my crazy pill. Teresa, you know I be tripping. I call this my crazy pill because it's Cymbalta. It's because I be having panic attacks because when I get in a lot of pain, I just automatically panic. So they gave me those pills to calm me down, but I call it my crazy pill because they do more than just calm me down. I be like comatose. So this is a pain pill. This is another pain pill that I take. Because why do I need to take 2 different pills? Pain medicines. Just give me something that I could just take one. Like, I think it's stupid. Like, they give me tramadol and then they give me naproxen, which naproxen ain't nothing but like an ibuprofen. Why? The shit don't even work no more. Like, it don't even help no more. Like, I'm telling them now, I need something else. And then this is Nexium because the rheumatoid arthritis affects my esophagus and stuff. So that's just 1, 2, 3, 4, 5, 6, 7, 8. That's 8, 9, and I got a couple more. I take like 10 pills a day just to deal with rheumatoid arthritis and other stuff that, you know, affects my body. And plus I got the eye drops because I don't produce tears anymore. So I got to use the eye drops to keep my eyes moist. And I just found that out this year too. And so they talking about doing surgery, but I'm not going to let them do surgery on my, there is no way in God's green earth that I'm going to let them break my bone in my foot, reset it, put a pin or whatever the heck it is that they want to put in there and learn to walk all over again at 43 years old. I told that doctor, I said, I will do this when it gets to the point where I can no longer walk. So yeah, I'm not going to do it. And so if I can't walk, then I'll do it. But as long as I can get up, still scream and yell and cuss the kids out and crawl to the bathroom, that's what I'm going to keep doing. But other than that, I'm just not. I can't do it. So do anybody else have any other questions for me? I kind of went over a lot today. I'm going to probably do another one. I'll try to do maybe like once a week or every 2 weeks. I haven't decided on how I'm going to do it, but I'm going to kind of like keep y'all updated on my day-to-day with rheumatoid arthritis. And as you can see, I'm stuck in the bed because I can't move and I'm hurting so bad. So yeah. So if nobody else have any other questions for me, Teresa, you should probably ask your questions if you still here with me, because you never at home when we have like our family meetings and stuff to find out like what's going on. So so you can ask whatever questions you want. Like I said, I don't mind answering questions. But yeah, it has affected me in so many ways. Like, I get mad. I'm mad at the world. But I said today that I am not going to let rheumatoid control me anymore. I'm going to learn to control it. So this was my my day where I'm giving in and I'm letting God, because only He knows, like, my situation. Only He can control what's going on in my life, and so I have chosen to let Him lead me, and He's still working on me. So, well, thanks everybody for tuning in. It's been real. My life from rheumatoid arthritis. I'll be joining you again sometime next week or the week after. And as always, stay beautiful, people. Stay beautiful, ladies. And if you're on my YouTube, please ask as many questions as you would like. I will go over in detail, like, how the normal system works when next time I do it versus your rheumatoid arthritis. So thanks again, and bye.